Good afternoon, everyone, and thank you for joining our second FHS webinar for this week after yesterday's wonderful discussion with Dr. Armenian. Today, we are pleased to host Ms. Dima Karam to talk to us about a very interesting project, 3 port cities of the Levant in the 19th century, urban identities and health knowledge exchange in the Mediterranean sanitary context. First, I will introduce Ms. Karam, and then I will leave the floor to her to present to us, and hopefully we'll have 10 minutes or 15 minutes of discussion at the end. So I invite you all to type your questions in the chat or let me know if you'd like to take the mic and make a comment. Dima Karam is a health communications specialist working on awareness information related to the prevention, management, and treatment of target diseases like cancer. She is also a freelance writer and photographer, published in the Daily Star and The Guardian. Dima holds a Master of Public Health from the American University of Beirut, a Master's in Health Education from Pierre and Marie Curie Sorbonne University, and a Master's in Health Information and Communication from Sorbonne Nouvelle University. It's always a pleasure to host a faculty alumni. Dima, the floor is all yours.
Thank you, Martine. I'm hoping the connection stays reliable because I'm hearing you in echoes a bit. It's hiccuping, so I'm hoping this connection stays reliable. Otherwise, I will reconnect to another network. Okay, thank you everyone for attending. This research study I'm going to present was done for a master's thesis in health information and communication and presented last fall at a program at Sorbonne Nouvelle University that included studies in production and circulation of medical knowledge. It was open enough to give me the liberty to delve into the subject. Okay, so Alexandria, Beirut, and Smyrna, the merchant cities of the Levant, subjects of the study, were 3 essential key ports in the Mediterranean. The most international, with the exception of Constantinople, they were born from an alliance between France and the Ottoman Empire and developed following the expansion of the world economy and the arrival of steamships in the 19th century. The European presence in the East, facilitated by the Ottoman Empire's concessions, galvanized their international trade. Open ports, more cosmopolitan than towns of the interior countries, they experienced an important intermingling of cultures. Freer from association with race or religion, they were defined less by nationalities and more by the sea, and represented freedom from the nation state. On the front line between East and West, through sea transit, these cities are important points of fusion. They act as spaces for the transfer of different culture and practices. Beyond commercial and cultural exchanges, different realities and knowledges of health and medicine existed on both sides of these meeting worlds. This study focuses on this intersection of different knowledges of health. Did an exchange of medical knowledge take place as with others? If so, what transfer occurred and why? Similar in the melting pot of the communities they host, in the transit by sea of different cultures and practices, we will try to see if these port cities also give birth to a new health knowledge paradigm, their own, and if they manage to recreate their own practices. This study aims to combine the multifaceted urban history of the 3 cities with the elaboration of their health knowledge. This dynamic takes shape within a Mediterranean geopolitical context and certain health factors. The presentation will begin then by introducing the methodology, then the state of health of these cities' periphery and its specific problems. To understand why this region would be an interesting field of research, the particularity of ports, of these port cities as spaces of sanitary fronts, and indications as well of exchange of medical knowledge will be underlined. The analysis will then compare the three cities' urban identity and the elaboration of medical knowledge from the 19th to the beginning of the 20th at the period of their growth. Finally, I will try to present the limits of the study and possible grounds for further research on the role of these port cities as multicultural spaces, places of circulation of health knowledge. So we start with the methodology. First, the research's historical period had to be defined. The rise and growth of these Levantine port cities. It's from the mid-19th to the early 20th century, but evidence about medical knowledge is throughout the 19th to the early 20th. This is why the research delved into the whole 19th versus the period of their growth, which starts actually mid-19th. At the beginning, I tried to search for direct evidence in the literature, direct evidence on exchanges of health knowledge in these three cities. Evidence is really scattered. There are just indications, except for two recent French studies which take ports as first places of medical knowledge penetration from the west to the east. There is much more literature on the subject of foreign doctors and health knowledge circulation and exchange in Constantinople. In parallel, I did research on the history and development of port cities in the Eastern Mediterranean, Alexandria, Beirut, and Smyrna, on these cities and the Mediterranean as spaces of plurality and cultural exchange. Research also on health indications in the development of the cities, leading to sources on their quarantine structures. Historian Daniel Ponzak is an essential author on quarantine and lazarettos. A main historical reference, Philip Mansell's book, Splendor and Catastrophe on the Mediterranean, traces the history of these three cities, specifically from the Ottoman concessions to the development of their ports and their cosmopolitan character. At the same time, I also tried to research the construction of medical knowledge of the three cities, the history of medicine, population and health in the Ottoman Empire, around the Ottoman Empire, the mobility of doctors and the circulation of knowledge, quarantine structures in ports, and reforms of the health system. I also, of course, delved into research of each city, the history of medicine in each of the three cities, their medical landscape, who practices medicine there, the training of practitioners, the exchanges of knowledge and the role of missionaries and foreign doctors involved in its health structures. Then after compiling all the resources, I tried to distinguish the themes and the axes tracked down by compiling and classifying the most relevant results by themes or subparts. A more detailed definition of the subject matter's main themes was identified when reviewing the entirety of the content. So this study articulates three main axes. Analysis of the three port cities, Alexandria, Beirut, and Smyrna, history of the constitution of their cosmopolitan urban identity, the construction of an exchange of medical knowledge that takes place in a third axis, a Mediterranean geopolitical sanitary context involving economic and political factors. We go on now to, the state of health in the Mediterranean and its geopolitical context. The plague began to recede in Western Europe in the 18th century, but it persisted in the Eastern Mediterranean and in the Middle East until the 19th. This area represented fertile observation ground for foreign doctors. Expeditions of medical knowledge happened for doctors to perfect their understanding of the plague and their clinical skills. These outbreaks of plague in the empire confirm it as a reservoir of disease. It's referred to as the sick man of Europe. This expression, we all know, not only illustrates its loss of power, but also an especially important aspect to our subject here, its inability to appropriately manage disease and health. When a cholera epidemic spread by pilgrims reached Europe in the mid-19th, pilgrimage was confirmed for European powers as a vector of disease. it becomes the central theme of the Third International Health Conference in Constantinople. From the Hijaz, the epidemic spreads through Suez to Egypt and through Alexandria to the Mediterranean and Europe. So on their return route, Balkan or North African pilgrims had to start undergoing quarantine in Alexandria, Smyrna, or Beirut. Egyptian and Ottoman authorities collaborated with European experts to set up a sanitary strategy by modernizing the quarantine system in Alexandria starting from the 1820s. It's the first port before Beirut and Smyrna to adopt quarantine measures. But the real mission of this quarantine system was to prevent the spread of epidemics from the East to Europe. The subject of health and sanitation in the Eastern Mediterranean in the mid-19th was at the heart of an international mobilization movement that's born out of a crossing between diplomatic and commercial circles. This cross is covered by historian Silvia Schifolo. These international health conferences place, in fact, the control of quarantine to the fore. It is outsourced and placed under foreign supervision. So historian Schifolo places the birth of an international public health movement in this factor specifically, the need to control epidemics with pilgrimage as a vector. When a second wave of cholera hits the Arabian Peninsula after the opening of the Suez Canal in the late 1800s, 1881, this pushes even more European authorities to worry and to consider pilgrims as a growing threat for their health security. International health control is imposed on pilgrims passing through Alexandria and the Suez Canal. Quarantine posts in Alexandria and El Tor in the Sinai become the most important checkpoints for Ottoman and North African pilgrims. The last International Health Conference of the 19th confirms a package of anti-epidemic measures, including in Alexandria and El Tor, medical inspection, disinfection, quarantine, and treatment of the sick and the deceased. Now I move on to the particularity of ports as permeable spaces where sanitary fronts meet, and afterwards indications of circulation of practices to understand why this region would be a potential field of research. Ports are first porous spaces for the meeting of health fronts between foreign authorities and local ones. The taming of these ports constitutes an essential stage in the deployment of colonies. So the port is the first point of entry through which Europeans arrive in their colonies with doctors or health officers. These doctors are essential factors in facilitating implantation and trade in the ports. Also, the health status of colonists who lived in these ports is a subject of clinical observations for doctors in Europe. Text published by physicians on the state of health of colonists in the French Journal of Tropical Medicine and Hygiene illustrates what ideas the contemporary had of the colony's sanitary state and the danger they posed. Doctors of the French Navy share as well their confrontation with the epidemic pathologies they encounter in local populations during their voyages in the Eastern Mediterranean in the 19th. They share them in state Navy medical reports or end-of-campaign reports. These doctors are part of a big medical acculturation movement of a more hygienic Europe. A clear link exists for these doctors between epidemics and Eastern cultures. The Orient for them and not Europe is the source of epidemics. Cholera in Syria, for example, for them, they say moves from the East to the West. They say we see epidemics everywhere diminishing as barbarism subsides. Cholera in Smyrna also for them is rampant only in the dirtiest neighborhoods and affects the grubbiest of people, while the cleaner European community is spared. They say Arabs live in dirty conditions and scabies is very common in Alexandria. They consider the health system and hospitals in Smyrna really insufficient. The doctors are poorly trained and the population superstitious. But for them, it's also the entire Mediterranean world or region that's perceived by them as a risk front for epidemics. Many ports, well in southern Europe, like in Greece, are also considered dirty and a source of fatal diseases. Faced with these health risks and the of health measures that authorities were starting to try to get adopted in Western Europe. These transfers of European hygiene rules take place in parts through ports that are areas of penetration and application of these examples of French naval medicine. But as pure cultural transfers do not exist, any transmission of knowledge supposes a reappropriation. Exchange also supposes reciprocities, as we will see further into the presentation. These naval doctors collaborate with a number of European and local ones based in the Orient, who frequently address European medical faculties about their observation of the plague, for example. For example, Dr. Shammas in Egypt shares his observation of the plague with the French Medical Academy. He notes how French doctors inoculate themselves with blood from cholera patients to understand transmission. Another doctor in Lebanon, Dr. Giusti in Tripoli, also argues with the Academy for the use of quinine sulfate to treat cholera. Another socio-political facet illustrating how ports were spaces where sanitary fronts meet. At the end of the 19th, the port of Alexandria is witness to the scientific rivalries between European colonial empires. Britain, France, and Germany sent their scientists to Egypt to investigate cholera. France with a commission organized by Pasteur. Germany's Robert Koch, the bacteriologist, manages to isolate a cholera bacillus in his laboratory in Alexandria. Now we move on to indications of on the circulation of health practices to further understand why this region would be a field of research. A study of postcards sent from Smyrna from the end of the 19th to the beginning of the 20th shows that some of the travelers who journey to the Levant to recover from an illness also take up local health practices in return. Like, for example, the practice of Turkish baths, seen as a means of curing disease. A British diplomat in Turkey considered the Turkish baths cause enough for some diseases that are seen in Europe not to be present in the East. In a more confrontational manner, a head-on encounter of health practices is seen when residents of a Palestinian village called Duwaime near Hebron resist forced inoculation attempts by British authorities. Familiar only with the practice of variolation, they hide their children in caves during a smallpox outbreak in 1921. I will add a note here that it's well established in the literature that the practice of variolation, transferring pus to confer immunity through a skin scratch, was already common practice in the Middle East when Edward Jenner made his cowpox vaccination discovery. And this well into the 20th through doctors and common healers. A circulation of health practices on the field can also be seen through the particular accounts of two English women in the mid-19th who traveled in Egypt, Lebanon, and Syria and shaped themselves as healers. Traveling to a milder Eastern climate to recuperate with what was needed to treat common illness and manage their own health, this gave them legitimacy to manage that of others in regions where health services were seen as inadequate. Without any medical training, these women traveled with a medical kit, a common ailment guide, and a pillbox to diagnose illnesses, treat simple ailments, and spread cholera prevention measures, for example. One of these women works with an Egyptian doctor trained in Europe and makes use of Western medical tools such as an enema machine. Now, to close this point and illustrate a more direct transfer of knowledge taking place through medical training from the West to the Eastern Mediterranean, certain physicians from Smyrna, Lebanon, and Syria and Egypt come to train at the Faculty of Medicine in Paris. From 1833 to the late 1800s, there are 130 among 330 Orientals. This attraction to European medical training had various reasons. The Ottoman Empire followed European sanitary policies and begins to equip itself with sanitary structures by calling on European doctors to manage them. Also, European and French doctors had important official posts in the Eastern Mediterranean. So now we turn to the presentation of the three port cities, their urban identity and construction of medical knowledge. What makes them unique spaces to study in regards to the elaboration of their medical knowledge and its exchanges. First, a little note. For context, the educational status of the Levant is a capital factor to define, to analyze a potential circulation of knowledge and practices. There's little information on what was the case of the Mediterranean countries, the Eastern Mediterranean countries, in in education before the first quarter of the 20th. But Lebanon seems to have had a much higher literacy rate than the rest of the countries of the empire, around 25%, accounting for 3/4 of school children in the Middle East at the beginning of the 20th. Access to missionary schools with low fees, printing presses, and books are a major factor. These same factors we will see are particularly present as well in the three cities. So we start with Alexandria. Alexandria is the city of the Ottoman Empire that grew the most in the 19th. It's home to the largest number of foreigners in Egypt and different communities that set themselves apart from one another and local Egyptians. It's home to communities, a multitude of communities of Greeks, Egyptian, Italian, French, and English, for example. It's the first Ottoman port to adopt unofficial quarantine measures before Beirut and Smyrna in 1812. In the mid-19th, it's described as a large caravanserai of merchants where all languages and races of Europe, Asia, and Africa intermingle. It's a fault line between empires, a diarchy where power is shared between Egyptian authorities and foreign consuls, and where the masses are in fact exploited. The cotton trade makes it an international port, but it's prone to outbreaks of epidemics like cholera. It has the highest mortality rate in all of Egypt, due in part to the presence of cotton fibers in the air. The first railway in the Middle East links it to Cairo. It's the first city in Egypt to have gas, electricity, and numbered streets. It becomes a publishing center in the mid-19th, where the most renowned newspaper in the Middle East, Al-Ahram, is founded by two Lebanese, and the first feminist newspaper in Egypt. The first feminist newspaper at the end of the 19th. It's an economic and cultural laboratory freer from the central Egyptian power. The construction of the Suez Canal after the mid-19th benefits mostly the French who manage it, and not the government nor the Egyptians. To illustrate the cultural influence the Europeans had, the Khedive, or governor, proclaims, "My country is no longer in Africa, we are currently in Europe." He spoke several languages and had in mind the idea of making the citizens of Alexandria Alexandrians, without the notion of natives or foreigners. The British Council becomes the real ruler of the city after its occupation at the turn of the 20th century. The cultural influence of foreign powers can also be seen reflected in the multinational makeup of its municipality. Egyptians, Greeks, French, English, and non-Egyptians ruled the city. It's also seen this cultural influence is also seen in the different multicultural schools that are established: German, Greek, Italian, American, and English. Public documents are written in French and Arabic. A university, Université Popolare di Alessandria, was founded beginning 20th century by an Italian tradesman family, with courses in all languages, including Arabic, open to all without distinction of sex or race or religion. Its different communities spoke until 1860 a form of simple Italian, or lingua franca, a vernacular language used first by sailors and merchants around the Mediterranean. French replaced it afterwards. It's the official language of these various communities between themselves and the governments. Street signs are in French and Arabic. A quarter of the students are enrolled in French schools at the beginning of the 20th. So at the beginning of the 20th, Alexandria is the commercial capital of Egypt, the third Mediterranean port for traffic of goods after Marseille and Genoa. its population doubles and becomes close to that of Cairo's, around 300,000. Now, about its medical knowledge. The Egyptian government collaborates with European experts in Alexandria to modernize the quarantine system in 1820. It had unofficial quarantine measures in 1812. It calls on European councils to form the Health Council of Alexandria and manage the quarantine and the lazaretto. This council, chaired by a foreign doctor, includes European doctors and consuls. It becomes governed by international law and operates as an international quarantine service to limit the transmission of epidemics to Europe and the health risk posed by pilgrimage. This council also acts as a center for transmission of medical knowledge. Foreign and Egyptian practitioners trained in Europe, Beirut, Constantinople, or Cairo rub shoulders there. Doctors also active in the Mediterranean or the international medical field bring their knowledge in. It's one of the few spaces in Egypt where local and foreign specialists exchange expertise on a more equal footing. By virtue of its international intention, this council creates a more open, mixed environment where medical information circulates more freely than in the rest of Egypt. This council also receives and retransmits epidemiological bulletins from various regions around the world. Beginning 20th, it becomes the Middle East Regional Office for the International Office of Public Hygiene created in Paris. In the late 19th, the quarantine ports in Alexandria and El Tor, we've mentioned, become the most important checkpoints for Ottoman and North African pilgrims. Now we turn on to the figure of a French doctor called Dr. Barthélemy Clot. The arrival of this French physician, Dr. Clot, in Egypt shows how trade development and the establishment of the health system in Egypt were intimately linked. This Dr. Clot founds the Cairo School of Medicine. He leads a smallpox vaccination campaign with Egyptian doctors, barbers, and midwives, which allows the population to increase around 1836. To limit epidemics, ensure the movement of goods, and secure Egyptian trade, this Dr. Clot helps enforce a sanitary code in Alexandria that's inspired by European reformers. His popular medicine book, translated into Arabic, is distributed for free in the provinces. He establishes a naval medical school and a teaching hospital in Alexandria. The role of midwives trained at the school he founded, who have access to women and children during vaccination campaigns, is essential. It's recognized by European doctors as being ahead of Europe. A circulation of knowledge can be seen in Alexandria, now we'll talk about it, between various practitioners based there, foreign doctors in charge of health services, and the debates of newspaper publications, especially around the subject of the plague. A Greek doctor in Alexandria who had spent time at the Pasteur and Koch Institute, he's called Dr. Vassolopoulou, is one of the first to describe the transmission of the plague through rats at the beginning of the 20th. His account is published by the Paris Academy of Medicine. Preventive measures he recommends for the plague are after consulting with several European health authorities figures in Alexandria. He also supplies the city with its own anti-diphtheria serum. The municipal council, founded end of the 19th in Alexandria, that decides on laws and health campaigns, is controlled by the quarantine council. This quarantine council, as we saw, is headed by foreign authorities. The health services director of the municipal council is appointed after an international competition. Councils and heads of religious communities cooperate to limit the plague epidemic at the end of the 19th by urging the population to report cases. Alexandria then, as well, interestingly, had its own supply of the Hapkin plague vaccine, which was developed by a Ukrainian scientist. Now, about the city's sanitation system rehabilitation. Measures to rehabilitate it are made by the German Director of Technical Services in Berlin, before he takes over this role in Alexandria. Health reforms lead the British Medical Journal to claim Egypt's general asceticism at the end of the 19th. The numerous press in Alexandria relays sanitary issues according to allegiance. For the British press, quarantine is an obsolete measure manipulated by France. For Arab nationalist dailies, the plague is an opportunity to embarrass the British, while the French press puts forward conspiracy theories. Interestingly, moderate Arab publications in Alexandria relay European doctors' research on the transmission of the plague and share preventive measures. We turn to Beirut. Beirut began to prosper at the beginning of the 19th by becoming the main port of entry for internal trade with Syria, replacing Sidon. At the crossroad, on one hand, of long-distance trade between India, the Hijaz, going up to the Mediterranean via Damascus, and on the other, of the Silk trade between the Middle East and Europe, particularly Marseille. Unlike Smyrna or Alexandria, though, its prosperity is from the start local. It's a republic of merchants who have their own power. It has the advantage of three factors: geographical position, Mediterranean border between Europe and Asia, the linguistic skills of its merchants, and their networks abroad. Its business and maritime traffic increases markedly as soon as a jetty is built on the port. Foreign companies get established there, as well as European and American consulates. Most trading agencies are non-local. Its merchants make use of European books and speak fluent Italian, probably lingua franca, this around 1840. To demarcate their independence, consuls refuse to take off their hats in respect of authorities and take various local communities under their protection. Beirut is a publishing center from the mid-19th. It publishes the first Arab daily by the first private printing house, and it has the highest number of newspapers and periodicals of any other Arab city. It starts to change rapidly a bit before the mid-19th. A main factor in its growth and is education. It shapes itself as an educational capital. A multitude of European and Anglo-Saxon missionaries compete for influence to establish schools. The first school for girls in the Ottoman Empire is founded in Beirut or in Smyrna around 1835. Some accounts say it's Beirut. The first university in the country is founded, we all know, by Anglo-Saxons, 1866, followed by that of the French Jesuit missionaries. A modern port, quays, and a railway line that link Beirut to Damascus at the beginning of the 20th put it at the same commercial place as Salonika. 11% of the Ottoman Empire's business gravitates through Beirut. The city doubles in size, around 90,000, at the dawn of World War I. Now for medical knowledge. Starting with the medical landscape, in the 19th century, several foreign doctors practiced in Lebanon and Beirut, alongside ones who've graduated from Constantinople or Cairo, and practitioners trained from father to son, healers and bone setters. The first graduate Lebanese doctors are trained at the medical school founded by Dr. Clot in Cairo in 1836, at the request of the then ruler of Mount Lebanon and Beirut, Emir Bashir. One of these first graduates popularizes the treatment of malaria in Lebanon with white quinine before the mid-19th and a few years after its discovery by French scientists. One of these doctors as well, graduate of Cairo, also performs the first tracheostomy with Dr. Post, missionary teacher at the American Medical School. Some examples now can highlight how certain practices are introduced or applied by foreign practitioners living in Lebanon. Before the advent of vaccination, a practice of variolation that consisted of mixing a recovering patient's smallpox crusts in breast milk was customary in Lebanon, as well as a type of scarification with pus. An Italian doctor introduced smallpox vaccination by vaccinating the Emir Bashir at the beginning of the 19th and recommending the new vaccine. The practice then spread in the country at the beginning of the 19th, when an epidemic was rampant in the region. Before official quarantine structure, another Italian doctor as well was charged by the emir with managing quarantine measures, such as the isolation of the sick and checking travelers up when a plague outbreak reached Lebanon. The first anesthesia is also performed by Dr. Post, mid-19th, with the help of a local brew, Ara. Dr. Post is assisted by an Armenian doctor who had fled Turkey for this anesthesia. In order to avoid slowing down the economic development of the region, a quarantine system is necessary in Beirut. Egyptian authorities wished to make it one of the Orient's main ports of trade with Europe. The health committee that establishes the 1834 quarantine structure is made up of European councils and the Egyptian governor. France, Austria, Denmark, Spain, and Greece advanced the necessary funds and ensure the quarantine's management through a health council. The measures are led by the councils, and a European doctor examines the travelers. The rise of Beirut as an educational capital conducive to the exchange of health knowledge finds no better illustration than the establishment of two medical faculties. There's the religious cultural game of influence that gives birth to different faculties of medicine. The Anglo-Saxons are first to establish a medical school in 1867. Classes are in English at the end of the 19th, after starting in Arabic. A jury from the Turkish Imperial School and the Constantinople Medical School validates the diplomas. The school is run by a council made of missionaries, Anglo-Saxon missionaries, American or English councils, and notables. This is not new. The French Jesuit missionaries hurried to found their own medical school immediately afterwards, with teachers and courses in French. A French state diploma is issued after an exam by a Turkish and French jury. This school, compared to the American one, depended more on allocations from the French government and its Ministry of Foreign Affairs. This ministry chose directly the teachers and the examination board. So training in a missionary school favored admission to these faculties. These faculties set the scene for a cultural melting pot and give birth to a cosmopolitan educational and medical environment. Most students of these faculties come from Mount Lebanon. Of these two faculties, the French and the American, come from Mount Lebanon, Beirut, Damascus, Aleppo. A quarter comes from Anatolian provinces, including Smyrna and the Armenian regions, and Egypt. From the mid-19th to the beginning of the 20th, more than half of the 10 hospitals that operate in Beirut are governed and founded by foreign missions. French doctors teaching at the French Faculty of Medicine carry out the first epidemiological study in Lebanon, which reveals the most frequent diseases at the end of the 19th. Malaria, syphilis, urinary stones, typhoid, and tuberculosis are the most common diseases. Now for medical journals. Al-Tabib is Lebanon's first medical journal, created for students at the American Medical School by Dr. Post. An association to fight against tuberculosis that's considered taboo then is established after a Lebanese doctor makes in the journal the first public mention of TB. Beirut's French and American medical faculty teachers made the first use of radiography and the new X-ray technology just after its introduction in Constantinople at the beginning of the 20th. Now we finish with Smyrna. Smyrna was made up of a large number of multi-confessional communities at the end of the Ottoman Empire. Greek, Armenian, Turkish, Jewish, and European communities live there. It's called Gafur Smyrna, Kafra Smyrna, because of its large number of non-Muslims. There's a freedom to practice religion and different places of worship. A mixture of 12 languages was spoken there, was heard there. Much before the 19th, though, it was already a major port for the Ottoman Empire. It was also a major international trading port for France in the 19th. Its commerce links it more to Europe than to the empire, and its trade with Europe and other ports like Beirut and Alexandria is dominated not by the Ottomans but by foreigners. It's at the heart of a vast network of internal trade lines and represented an essential route for all goods to and from Europe. Also, it's the ideal place where Europe could observe the Ottoman Empire and Asia. The consuls there, who also acted as commercial brokers, had a lot of influence and were key figures in the city. The main language, like Beirut and Alexandria, more like Alexandria, spoken until the mid-19th was Italian and the lingua franca. It's a city fundamentally defined by its trade relations, which transcend all religious, national, and communal differences until the beginning of the 20th. The unique dynamism that animated it at that period, its distinctive identity and urban culture were born out of the rivalry for control and power that was shared by local elite groups. Who were its elite groups? They were Ottoman province officials, ambitious merchants of diverse backgrounds, and consuls of European powers. The construction of Smyrna's port, Stone Quay, was the empire's largest urban project in the second half of the 19th. The port and the quay are run by the French. The network of missionary schools multiplies after the mid-19th, as well as a number of newspapers and printing presses of all denominations. To illustrate its melting pot, an Ottoman Chamber of Commerce is established with an Armenian president, with Turkish, Greek, and Jewish members. Other English, French, Italian, and Dutch chambers of commerce are also established. Smyrna's governor in the late 19th speaks, for example, Turkish, Greek, French, and English. Half of the Ottoman international trade at the beginning of the 20th passed through Smyrna. It was home to 190,000 inhabitants. It enjoyed its own law. The presence of foreign ships in the harbor guaranteed the peace. Like Beirut and Alexandria, it represented a form of freedom from the nation state. It was the site of several first initiatives in the empire, the first newspaper in the empire that's in French, the first book in English published in the empire, the second railway, the first American schools, and the first city in the empire to have electricity. Now about its medical knowledge. Before the 19th, through its melting pot of cultures, Smyrna already testifies to a circulation of medical practices. For example, an Italian doctor who was also consul of Venice and based there practices variolation and sends his note to the Royal Society in London before the accounts of Lady Montagu. She was the aristocrat who lived in Constantinople with her diplomat husband and popularized the practice of variolation in the UK before Edward Jenner's discovery of vaccination. The different communities in Smyrna determine the status of health services. Greek, Italian, English, French, Dutch, Armenian, Jewish, and other hospitals, foreign hospitals, function in Smyrna in the 19th. Its sizable import of medicines for the needs of its foreign communities shows a penetration of Western remedies. There are frequent advertisements of French medicine preparations signed by French doctors in its newspapers. Archives in Smyrna's French journal question the circulation of health practices and whether a modernization of health sciences will take place. There are Italian, German, French who assume head positions of public establishment, or medical corps in the mid-19th. A French doctor, for example, travels to Smyrna from Egypt to observe the plague and shares his theory of contagion. Franco-English, also allied forces, and a team of English practitioners transform its military hospital in the Crimean War into a civilian one in the mid-19th. They also form a society, a medico-surgical society. It's the third port after Alexandria and Beirut to set up a quarantine structure in 1838. But this quarantine structure served also another purpose. It was actually a means also to collect information on all those passing through it, merchants, migrants, diplomats, and travelers. The quarantine initiative in Smyrna is part of a broad set of reforms in the Ottoman Empire in Turkey called Tanzimat. Now, about the figure of an English doctor called George Rolleston. This English doctor's report on Smyrna testifies to an act of health knowledge exchange. He was a doctor who worked at the civil hospital in Smyrna in the mid-19th. He shared his observations on the causes of frequent illnesses and the treatments followed by local practitioners. He adopts remedies used by Smyrnaeans and Smyrnaean doctors and suggests different treatments for malaria and he describes the epidemic risks of different environmental conditions in Smyrna. In how distinctive Smyrna's dynamism and identity reflects in health policies, during epidemics, the central power, councils, doctors, and expert committees, the expert committees themselves made up of councils and foreign delegates, decide on the adoption of public health measures, like the ordering and distribution of remedies and the construction of hospitals. Now, looking into folk medicine, a study of a mid-19th century Sephardic domestic medicine booklet from Smyrna reveals the exchange of medicinal culture of its different communities. This booklet, this folk medicine booklet, cites a high number of recipes, illnesses, and ingredients. It's adapted to the dominant diseases of the second half of the 19th. Its recipes reveal variants of local names shared with Turkish and many ingredients in common with Attarin or Turkish herbalists. Half of the ingredients in this book are still used today in Turkey and Greece. In the 19th century, a number of doctors from Smyrna were trained in Paris. We saw that a bit earlier. With Beirut, it's the first city after Constantinople to use X-rays at the beginning of the 20th. If there's still time now, we turn on to a comparison of these three cities.
We need to wrap up, Dima, because we're 4 minutes past 1, and we need to allow at least a couple of minutes for some questions. So if you can wrap up in 1 minute, it would be great.
Yeah, I'm not sure I can do that. Okay, I'll try to be quick. Alexandria is the first port to establish a quarantine office among the three cities. It represents an internationalization of a health problem linked with epidemics and pilgrimage, where we can see the budding form of an international public health movement. It's a living laboratory as well for observing diseases. It reveals an important female healthcare role unseen in the other two cities, with the midwives trained at the school Dr. Klo founded, accomplishing significant work in immunization. Beirut is the smallest of the three cities, but it's the only city where medical schools are established after Constantinople and Cairo. It exemplifies a transfer of French and Anglo-Saxon health practices. It also produces medical knowledge and creates a cosmopolitan medical environment around these two faculties. Smyrna's quarantine station is a main factor for its economic propulsion. Like Beirut, its multi-faith communities define its health system through networks of hospitals that serve them. With the heady influence of consular bodies, the physicians in Smyrna participate in the municipal council to determine the aspect of Smyrna's sanitary state. The dynamic in Smyrna points to the importance of seeing the exchange of health knowledge in it as a form of diplomacy. I wanted to touch on the limits of this study at the end a bit, but the main limit of the study is basically that Western sources were not balanced with local ones, like Arab, for example, to try to analyze an East-West transfer of practices. The study relies on the health status and trade in these cities from the perspective of Western literature. Another main limit of the study was the lack of access to the archives of consular correspondence from the merchant cities with foreign affairs ministries. Another limit as well is that the figures of doctors disseminating knowledge are mostly European living in these cities rather than Arab or local doctors. And the amount of proofs for the circulation of health knowledge is not equal for the three cities. Alexandria has the most, Beirut in a more limited number. That's it a bit about the limits of the study.
Thank you very much, Dima, for this historic overview in geography and time. It's unfortunate we don't have much time for discussion, but I have a long list of comments. So maybe I'll try to read some of them, or if you have access to them, because some of them are just comments or additions to what you mentioned in terms of historians or medical doctors in each era. Those from Dr. Nabil Romful are along that direction. Also from Salim Adib.
Yeah, too bad they are almost ruined now. I read that comment. Yeah. But you know, in doing this study,
yes,
is there any question in the comments? Any question that we can address? I'm trying to check if there are any questions.
Also, Judy has a long comment saying that the presentation seems to be one which presents Eurocentric angle of the history of the Arab world, which is of course not the sole version. Unfortunately, this is a pro-colonialist view which absents the rich civilizations of our parts of the world and with no reference to our historians, medical doctors and scientists who have been active and wrote so much about the context of disease and health. I expected to hear some reference to that, given that this is about this part of the work, perhaps George Salibi's work or Albert Horani, and even reference to writing emanating from our region could help add a different perspective. And then
yes, I tried to. Yeah, one of the limits is that Arab resources were not studied, and the main limit was basically this study was done at the start of the pandemic, so access to libraries was restricted. So I had access to online resources mostly, but Arabic sources were not studied to also see not only European centric, but to see if any transfer occurred or circulated from the east to the west as well. To try to check that point as well.
Okay. I think with this we can wrap up. Salim is saying Smyrna is now Izmir. Alexandria become important to the U.S. Navy, and after World War II, with Point 4 Naval Epidemiology Center very active in the Eastern Mediterranean region. And also the archives in AUB and USG and the Orient Institute in Beirut are very rich with local information. Nabil is saying Damascus University has excellent resources about this period in Arabic. With this, I think Dima will have to review the long comments in the chat and see whether she can benefit from the advice given. Thank you very much for this presentation and this trip or journey over time and places in the region. Thank you all for being with us today. Have a great rest of the week and see you soon.
Thank you.